Thank you for joining me today. Today I have medication here that I want to go over with you. And this medication called Amoxapine. Amoxapine is a tricycle antidepressant medication, and it's older antipsychotic medication with unique property. It has antipsych effect and depression effect. Mechanism of action of Amoxapine is that it inhibits norepinephrine and serotonin reuptake. It metabolizes in the 7H and blocks dopamine receptor. It has a dual effect. It has antipsychotic effect and depression effect. Amoxapine is pharmacokinetic of amoxapine includes anticholinergic effect like dryness, dry mouth, constipation, and also antihistamine blocker like sedation, weight gain, and is also alpha anergic blocker which lowers the blood pressure. It also has dopamine blockers with increased risk of ABS symptoms. Amoxapine pharmacokinetics include it absorbs well in oral, it metabolizes in the liver, and it eliminated in the or excreted from the kidneys. The half-lifetime vary and fluctuate based on the metabolite. Clinical use of amoxapine include that major depression disorder, especially patients with agitation and psychosis features. It treats resisted depression and rarely used today because of the side effects of EBS and seizure. It increased the seizure also. Dosage strategy. Typically, dosage is between 100 to 300 milligram a day, often given at the bedtime due to the sedation that the medication has. And you will start low and titrate slower on this medication. Side effects of this medication include, as we talked about, dry mouth, constipation, urine retention, sedation, weight gain, low blood pressure, EBS, increases seizure more than the other TCAs. It has a risk for QT prolongation and arrhythmia. So if the patient already have symptoms for cardiac, you don't give that to that patient. You will monitor baseline and periodically for the EKG. You will monitor EBS and abnormal movements. You will also monitor anticholinergic like dry mouth, constipation, what we talked about. You will evaluate seizure risks. special population to consider. For elderly, it increases sensitivity to the side effects. So they are more sensitive to the side effects because the medication stay their body longer than other younger population. Patient with cardiac disease, use cautionly or avoid at all. It has a seizure risk, so you will consider seizure. And if the patient has a seizure risk or had a history of seizure, or let's say they have been using alcohol or alcohol withdrawal or risky, that increase their risk to have a seizure, this is contraindicated for those patients. And it's also, you will also avoid if the patient is pregnant unless the benefit outweigh the risks. So Amoxapine is one of the few antipsychotic medication with the Amoxapine is a few antidepressant medication with antipsychiatric medication. It has the antipsychotic effects and may have a faster onset than TCA medications. It's rarely used because of the EBS and seizure risk, so you will be cautious about that. Takeaway from this medication lecture is that Amoxapine is a TCA with unique property. It blocks dopamine and it is effective on depression, psychosis, agitation, and it has a significant side effect that limit its use. Requires carefully monitoring and patient selection. So you will monitor all the symptoms, but you only select a few patients who are not pregnant, who don't have a seizure risks, who are not that old, so they don't have a liver injury or kidney or heart. So it's that limit the usage of this medication. Thank you for joining me today. I would love to see you in my next video where I also will go over other medications and case studies.